Welcome to the next video. Step 1. Ask the clinical question in PICOT format. As we have already seen, asking questions is necessary to understand our daily clinical practice or to make decisions in the face of possible uncertainties. We must distinguish that our questions sometimes have a general character, basic questions, and other times seek to know a specific aspect to make decisions or perform certain clinical actions. In everyday clinical practice, we frequently need new information concerning treatment. For example, which intervention is the most effective? Diagnosis, how useful a given diagnostic test is in a given clinical situation. Or prognosis, what are the chances of making a full recovery? The choice of the source of information depends on the type of question, but before you start looking for an answer, you have to put forward a precise and clinically reasonable question. And in this video, I will show you how to do that. Clinical questions can be categorized as either background or foreground questions. Here we have background questions. And determining the type of question will help you to select the best resource to consult. Background questions are those of a more general nature, which you can answer by consulting manuals, textbooks, etc. This type of questions typically ask who, what, where, when, how, and why about things like a disorder, test, or treatment, or other aspect of healthcare. On the other hand, foreground questions, or also called clinical questions, are generally very detailed questions that can best be answered with the information contained in published research studies, for example, scientific articles and clinical practice guidelines. These questions typically concern a specific patient or a particular population. They tend to be more specific and complex than background questions. Quite often, foreground questions investigate comparisons such as to drugs, to treatment, or the effect of certain risk of prevention factors. Remember that only by asking a precise and clinically reasonable foreground question, we may find the appropriate answer and make a sensible decision as for the further handling of the patient. We are going to see some examples to differentiate what is a background question and a foreground question. On the left side, I'm going to show you some background question, and in the right side, you will see the question transformed in a clinical question using a PICOT format. The first one is, how does acetaminophen work to treat fever? And the foreground question could be, how is fever modified by acetaminophen when compared to ibuprofen in children? The second example of the background question is, what is the best method to prevent pressure injuries during hospitalization? And the foreground question could be, patients at risk of pressure ulcers, how do comprehensive matrices compared to pressure covers affect the pressure ulcer incidence? And the third example is, how do hemodynamics change with patient position? And the foreground question could be, how does prone versus supine position affect mortality in patients with COVID-19? Here, you must be clear that clinical questions arise during our encounters with patients and relate to the central aspect of their care. They are usually related to questions about prognosis, diagnosis, treatment, etiology or risk, prevention, and others about beliefs and values. Look at the table of the slide and check the different types of domains of clinical question. Here in this column, you have the type or domains of the questions. We have therapy or treatment, prevention, diagnosis, prognosis or predictions, etiology or risk, and meaning. In the third column here, I showed you the types of research studies that are adequate to answer each type of clinical question. For example, to answer a therapy or treatment question, we will select or seek randomized controlled trial. For prevention question, we will choose randomized controlled trial or prospective studies, and go on. We will explore several examples now from each domain to gain a clear understanding of them. Let's show you. The type of domain therapy or treatment. This type of question try to respond what is the effectiveness of the interventions in improving outcomes in sick patients. We should seek some randomized controlled trial as the best evidence to answer the clinical question. And this is an example of this type of question. In school-age children, what is the effect of a school-based physical activity program on reducing the incidence of childhood obesity compared to no intervention over a 1-year period? Another example, in this case, of the type or domain of the question is prevention. That questions about interventions or exposures in preventing morbidity or mortality. This is the example. For adults over age 65, does a daily 30 minutes exercise program reduce the future risk of heart attack compared with no exercise program? This is the next one. The type or domain of the question is diagnosis. Those are questions about the ability of a test or procedure to differentiate between those with and without a disease. We will see in this case cross-sectional or cohort studies. This is an example. Is a yearly mammogram more adequate in detecting breast cancer compared with a mammogram every 3 years in women under age 50? And now we have here an example of prognosis or predictions. Those are questions about how to estimate our patient's probable clinical course over time. In this case, we will seek cohort studies on case control studies. This is the example. Does flash continued glucose monitoring improve glucose control in people with type 1 diabetes during the first 6 months after being diagnosed with the condition? This is the other type or domain of questions, etiology or risk. Those are questions about the probable cause of a patient's disease. In this case, we have this example. Are males 50 years of age and older who have a history of 10 years of smoking or more at an increased risk of developing esophageal cancer compared with males age 50 and older who have no smoking history? And the last one type is the meaning. Those are questions about patients' experiences and concerns. And in this case, we will seek another type of studies that we call qualitative studies. This is an example. How do teenagers diagnosed with cancer perceive chemotherapy and radiation treatments during the first 6 months after diagnosis? As you have seen, formulating a well-structured clinical question is a priority. Without a well-focused question, it can be very difficult and time-consuming to identify appropriate resources and search for relevant research evidence. To construct a clinical question, we use a specialized framework called PICOT to form the question and facilitate the literature search. You can see here in this slide the PICOT, P-I-C-O-T, is an acronym from the first letter of the words which encode individual elements that create a well-formulated clinical question. It is a frame that allows to ask a question correctly. Formulating clinical question following this frame facilitates you to translate your question into a standard format that allows your question to be answered by clinical research. Let's see what is the meaning of each of these elements. The P, patient, problem, population. We must define this element respond what are the patient's demographics such as age, gender, and ethnicity, or maybe what is the problem type. The E component, it could be an intervention or even an exposure. This element refers to what type of intervention or exposure is being considered. For example, is this a medication, procedure, or a lifestyle modification? The C component, is there a comparison, treatment, or exposure to be considered? The comparison may be with another treatment or exposure, such as exercise or placebo or no treatment at all. And the outcome element is what would be the desired effect you would like to see. Are there any side effects involved with this form of treatment? There may be more than one effect or result. Think about the one that interests you most. And the last one, time frame, it is used to determine the duration of an intervention or the study outcome. Now we are going to practice a little because it's very important to be able to recognize the different elements in our clinical questions. Here, I want that you think a few minutes. Where are the elements of this clinical question? You can stop the video and think a little. The question is, how does prone versus supine position affect mortality in patients with COVID-19? Stop the video. Okay, now here, did you write in a paper what is the element P? Okay, I'm going to say you. The element P is patient with COVID-19. All right. Did you respond correctly? Okay, perfect. Now the second element, think in this one. The I, it can be an intervention or exposure. In this question is an intervention. Can you tell me what it is? Or can you write in a paper? Okay, it's prone position. And what is the comparison element? Okay, this is supine position. So in patients with COVID-19, we are going to know, or we want to know, if prone position compare with supine position, and now we are going to discover the last element, the outcome. In this case, we are interested in to know the effect in the mortality. So we have here the 4 elements of the PICOT question. Now we could find or seek research about this question more clearly and facilitate our research in this case. Finally, consider what type of clinical question is. Okay, this is a prognosis or predictions. Yeah. Okay, how has it been going for you? I hope everything is going well. In the review activities, you can test how well you are able to formulate a good PICOT question. Don't forget to do them. And see you on the next step. Thank you.